Hi, my name is James Jesso, and what you're about to hear is a clip from episode 196 of the Adventures Through the Mind podcast. This clip is with Dr. Alex Bekker. The larger episode is an exploration of chronic pain as a collection of conditions, and where psychedelic medicines, can fit into the treatment of chronic pain, specifically as novel treatment agents that are able to address the sort of multi-factorial condition of chronic pain from multiple different directions or multiple different angles simultaneously. In the clip you're about to hear, Dr. Bekker is going to explore the 4 different ways in which he proposes that psychedelics may work as this novel treatment agent for addressing chronic pain. If at any point during this clip you'd like to just listen to the whole episode, you can jump over. There will be a little card up on the screen that takes you straight over there if you'd like to check it out. It's also available on all major podcasting platforms, episode 196. And before the clip starts, if you are interested in longer deep dive conversations on psychedelics, in particular questions that have to do with psychedelic culture, medicine, or research, please consider subscribing here to the channel. All right, enjoy the clip.
Classic psychedelics, which include LSD and psilocybin, DMT, partially MDMA, they work on serotonergic system. This is what they call 5-HT. There are like 9 or 10 of these receptors. This particular drug works on 5-HT2A. And what they do, I guess I will call 5 elements. One would be they will promote neuroplasticity because these receptors and the synapses, and together the synapses and receptors involved in formation of new synapse may potentially create new connection. So this is part of direct effect of this drug. They also anti-inflammatory component, and this is very well proven, especially for psilocybin in animal models. Serotonin receptor are responsible for inhibiting pathway. They originate in a structure, what you call periaqueductal grays in our brainstem, and most of these receptors are actually both cannabinoids receptor and serotonin receptor. So they enhance this inhibition. They promote synaptogenesis. What it means, you will have more of synaptic connection based on serotonin transmission. They also actually remodeling. End of this dendrite consists of small little spine, dendrite spines, they call it, which actually perceives this signal. So with psychedelics, they again, most what I will talk right now, from now on, it would be classic psychedelics, serotonergic psychedelics. There are other, but right now we know little about them, so let's focus on that. So this substances increase the number of this dendritic spine and enhance the signal just from there, just having more locators, we would say. It enhanced network connectivity, and this is probably a major mechanism by why serotonin receptor will work. It's reduced central sensitization. It enhance inhibition of signal. It's promote neuroplasticity through synaptogenesis. And their minor indicates unclear, but people believe that they activate certain genes which responsible and this is what you call epigenetic. When you have substances around part of a cell which activate synthesis of particular protein or neurotransmitter. Our DNA generally, DNA not working all the time. You activate genes at particular need or whatever it is, so they activate right gene to create new synapses and new connection. So when you create new connection and they kind of reset, whatever your default mode network can be reset when you give psychedelics, your core network, your default mode network is disrupted, and at that time it gives ability to form new connection. And pain connection probably still exists, but they wouldn't be dominant. You form new connection, and time, like anything in memory, fortunately we don't remember all of things, otherwise we'll go crazy, right? So with time, if you not enhance some signal, it will disappear. So it's not right away, but your pain connection, if you form new healthy connection, start doing something other than thinking about your pain, it's not there. You have something else. You created task positive network, which is more responsible for when you with yourself, you don't think about pain and ruminate about pain all the time. You have other things to worry about or think about, and this becoming more normal. We should be, everybody, stress is part of it, stress of our life. But when you focus stress on one particular aspect, all other part you neglect, and you're not dealing what you're supposed to do. You keep thinking about pain. So this type of new connection, which is serotonin activations of serotonin receptor would lead to that. How you activate, it's, I wouldn't call secondary. We have a SSRI, which is increased level of serotonin in the brain, but it's only one aspect. Psychedelic works on many aspects of chronic pain. That's why I believe it's would I say it's a magic bullet? Probably not. Like everything right now, where I see it, it's one of the unusual characteristic of psychedelic. So they work on many aspects of this chronic pain, biopsychosocial. So they will affect bio, they will affect psycho, and they will affect your social interaction. In this case, I have to bring MDMA, probably the strongest. MDMA, it's not your typical classical serotonergic psychedelic. It has also a component of dopamine activation and oxytocin activation.
And norepinephrine as well.
Right, but in this case, why I'm focusing on dopamine, it gives certain pleasurable feeling, and oxytocin. It's a drug. It's not drug. It's a hormone usually released, let's say, after delivery baby. It's kind of established connection with other person. So MDMA, you have this situation when you feel empathetic to others, and which it's kind of feedback loop. Others feel different about you, but this is. But in other more classic psychedelics have some element of this, but not as prominent like with MDMA.
So I'm gonna jump in. Like, what I hear you speaking to, and I'm gonna kind of refer to my notes from your paper while I'm saying this, is that you're, based on what we know about through the psychedelic research and all the different sort of aspects we've come to identify, and these are the things that these psychedelics do in this context, in this brain, and here's the result. That it's a fair hypothesis that developing a treatment protocol for chronic pain that includes psychedelics might end up being significantly more effective than our current treatment protocols, because they address a number of the aspects of chronic pain simultaneously on the direct biological level of their impact on the nerve tissue through its impact on serotonin and the perception of pain, but also through psychedelics having, or classical psychedelics having, a direct anti-inflammatory effect, which would, the inflammation is a part of the activation of these nerve cells. And you also said that it'll enhance descending inhibition, so it'll enhance your brain's ability to be like, no, you don't need to fire, like no need for that pain. And it also creates this opportunity where, from the psychological aspect of what we can experience and discover during our psychedelic experiences and whatever therapies and support it, we can have, like CBT can support the efficacy of a gabapentin prescription, we can utilize therapies during psychedelic experiences in order to amplify and reinforce new ways of relating to ourselves and our lives, such that we can maybe not deprioritize, but like sort of take a few step downs, like how prominent the changes in our perception related to chronic pain were. We can put chronic pain far enough down that we can reinforce these other aspects, such that chronic pain can slowly become less and less a part of our default mode network. And this is something that is theoretically reflected in an actual change to kind of networks in the brain responsible for how we perceive ourselves and our lives. And so in this way, we can address chronic pain on multiple levels, which of course would then change how we show up to the world. We have insights about ourselves and about our pain, about our behavior. That'll change how we behave in the world, which will change how our social world responds to us, which then gets into the social aspect of it. And so there's this one drug, or one class of drugs, can be utilized in a way to target all of these different issues related to chronic pain in a way that actually can make substantial long-term changes that are not dependent upon continued administration of the drug in order to reduce the symptoms of chronic pain. Is that about right?
In 60s, when they start using LSD, it was adjunct to psychotherapy. This is how it was actually used and advertised. It's not by itself, an adjunct to psychotherapy. You have anxiety. Chronic pain was a small part of it. We talk about more anxiety, depression, at that time they didn't use the word PTSD, but one way or another, it's a part of it. So with psychedelic, when they kind of start breaking up your default mode network, psychotherapy will help you to establish new network. Psychotherapists will discuss with you how important it is to have this connection, or I don't mean brain connection, I mean human connection, and whatever psychotherapy issue you're resolving, it will help to resolve. And I think partially this is how it works. Even current understanding, cognitive behavior therapy should be in combination with psychedelics. They do one part, they break and ready to start new connection, but psychotherapists have to help patient to form this new connection. They don't start from nowhere. So you have to, it's a suggestive kind of cognitive behavior, change behavior, and you start forming new connection. But what psychedelic will do, it give you space where you can start forming this new connection. Right. So generally it should be in combination, and in combination even with more traditional drug. If you have disease like, I don't know, peripheral neuropathy, you probably still will benefit from using capsaicin or something peripherally, because you're still getting new signals there.
Like a topical pain relief.
Right.
Yeah.
It wouldn't help you in, like, say, if you have sciatica or something, it wouldn't help you. But if you have disease component, just like, again, diabetic peripheral neuropathy would be a good example. Yes, you still need to take, there it's kind of mixture. You have a peripheral signal, but you have already lots of central signal there, central sensitization, peripheral. So you will do both. You will do that, and you will use psychotherapy, use psychedelic to clear you from disrupt this connection, pain connection, which there, and now somebody would help you to form new connection. Again, this should be emphasized. Psychedelic ideally should be part of overall treatment, not just, again, it's not you take mushroom and you're cured. It wouldn't be like that. It should be part of multimodal type of approach where cognitive behavior therapy, mindfulness, or whatever you use, even, but somebody have to tell you what these connections, that you're missing social part, you're missing this part, you need to reestablish this part, and you to relearn. And psychedelic helps you to relearn this thing. It's kind of brain is, I wouldn't say child. I mean, obviously you have all this thing, but you clear from, you make it ready to learn new thing. And new thing would be critical in establishing this new connection.